There are some health issues babies are facing in the first 12 months of life, such as vaccinations. Vaccinations are recommended for children depending on their age, according to Western medicine. And some of the common ones are for chickenpox, diphtheria, tetanus, pertussis, hepatitis A, B, HPV even, influenza vaccines, measles, mumps, and rubella, meningitis, pneumonia, polio, rotavirus, etc., HIV. So there's a lot, and the number keeps growing. There's a lot of vaccinations that children are getting these days. The idea is that vaccination prevents contagious and potentially fatal diseases. But there's a huge controversy over vaccinations. Why? Because of the large number, because many of the vaccinations are for diseases that aren't life-threatening. And that would be okay. I mean, there wouldn't be a controversy around it, except for the fact that some people do have negative reactions. And there has been some people who have become autistic and etc. And they're suspecting it's due to the vaccines. It's not proven. But also, people get really upset around vaccinations. Perhaps, it's from time immemorial. People have been paranoid about things like the plague, right? And so when the topic of vaccinations pops up, the discussion gets really heated, and there's lots of accusations and blame thrown around. So I just want to point that out, that there is just a huge controversy over this issue. Let you decide where you want to go with that. But here are some of the pros and cons that people are discussing. Some people are worried about mercury toxicity in vaccines, etc. So look into those issues and see if what you're going to choose. Some people will choose to vaccinate their children just a little later, like vaccinate them at 7 years old, something like that, so that their bodies are less sensitive at that time. Babies are will frequently get fevers. Remember, their immune system is not really experienced yet. It hasn't ever been exposed to some pathogens before. And so their newborns are at a higher risk for more severe infections. And fevers are generally the sign that they have an infection. Babies are not good at regulating their temperature, so their fever can spike wildly. Generally, though, people are afraid that if the fever is too high, they'll get brain damage. That is really rare. Usually, you can just let the body do its thing with a fever and call the doctor if they have a fever for more than 2 or 3 days, or follow the recommendations on that of Western medicine of when to take them to the doctor. If the fever's over 103, then you're generally supposed to take them to the doctor, even if it hasn't been persistent. Note that babies may get a mild fever when they start teething, but usually that fever is not over 101 degrees. Monitor the fever closely. Don't be afraid to seek medical attention, especially for small children and babies. Use a rectal thermometer for the most accurate results, and don't give your child a cold bath when they have a fever. Breast milk contains antibodies to help fight the infection. So if your baby has a fever, breastfeed them. Bone broths and easy to digest warming foods can be helpful if the baby's 6 months plus in age. Don't give them any cow or goat milk. Dairy, the nutrients in dairy can actually cause the fever to spike. So breast milk is okay because it helps provide antibodies, but otherwise no on the dairy. Certain essential oils can help reduce fevers, but it's very important to research the essential oil before using it. Some essential oils are not good for children. Essential oils in general are very potent, so don't put them directly on your baby's skin. You dilute them in a carrier oil Also, make sure that you keep essential oils out of the reach of children so they don't poison themselves. My third daughter, Francesca, gets very high fevers, and once she had a high fever up to 105.7 for 2 to 3 days. And at that point, I started rubbing a bit of heavily diluted lavender oil on her feet, and generally 1 to 2 drops in 1 teaspoon of vegetable oil. We used, I think, coconut oil in that case. So 1 to 2 drops of lavender essential oil in a teaspoon of coconut oil, and it worked. But I want to mention again, if your baby has a high fever, generally call the doctor. What about dehydration? Dehydration happens when your baby's not taking in enough milk, or if the baby has vomiting or diarrhea or excessive sweating, or if they're exposed to hot climates and sweating. So take dehydration seriously, especially if it's related to diarrhea. Remember that diarrhea is the number one cause of death worldwide. It's the most dangerous disease worldwide, especially in developing countries. And how does diarrhea kill? Through dehydration. So if your baby's vomiting or has diarrhea, be cautious to keep them hydrated. Sometimes babies will... why would a baby not eat enough? Babies, when they're sick, don't like to eat, number one. And they get dehydrated as a result. And number two, if your baby has a sore throat, they may refuse to eat because it hurts them every time they eat. And that could cause dangerous dehydration too. My oldest daughter, Carmela, she was not eating for several days when she had, and we just couldn't figure out why. And finally, she was starting to get listless, and I got really nervous, and I was about to take her to the emergency room, and I was like, well, let me give her some children's Tylenol as a pain reliever, because maybe she has a sore throat. I started wondering, well, maybe she's not eating because her throat's hurting her. Well, within a half an hour, she was ravenous and eating, and she was literally fine after that. Some common signs of dehydration are 6 hours or more of a dry diaper. The baby, if you're not changing diapers, your baby's probably dehydrated. If the urine's really concentrated, then they're dehydrated too. But for babies wearing diapers, it's hard to know what the concentration of the urine is. If the baby has sunken eyes, or they're dry crying, or their tears are really sparse, they may be dehydrated. Or if they have a sunken fontanelle. There's a picture of a sunken fontanelle right there. Lifestyle treatments for dehydration. Yeah, and first thing is to ensure your baby is taking in adequate liquids by measuring their fluid intake if they're formula fed. If you're breastfeeding, it's really hard to measure fluid intake, so then you have to measure by the diapers. Generally, be nursing your baby continuously if they're not continuously, but 8 to 12 times a day for the first month, 7 to 9 times a day for months 1 to 2. And newborns should not go for more than 4 hours without feeding, even overnight. But I'll tell you, in my family, we don't wake up a sleeping baby. I'm just telling you. So make sure that they're nursing adequately. Seek medical attention if vomiting or diarrhea persists. Start offering water to babies when they start eating solid foods, around 6 months of age. If your milk supply is low and that's the cause of dehydration, then give them galactagogue herbs give yourself start taking galactagogue herbs to increase your breast milk. And fenugreek is my favorite recommendation, but also cumin, fennel, shatavari, and vidari can help. Shatavari and vidari are more about nourishing the mom, whereas cumin, fennel, and fenugreek are more about vasodilation and increasing milk production directly. What about your baby's poop? Poop should look mustard colored and smell like yogurt if you're breastfeeding. Why does it smell like yogurt? Because yogurt is fermented milk. And that's exactly what happens to the breast milk in your baby's gut. So it should be mustard colored, smell like yogurt. Pay close attention to your baby if they're farting or have digestive upset, colic, etc. Pay attention to what you're eating, and you may need to modify your foods if you're breastfeeding, or the foods you're giving baby if they're eating solid foods. So colic is frequent, prolonged, and intense crying or fussiness in an otherwise healthy infant. And when I see that in my kids, I usually think, oh, they're having some digestive upset. And then I'll give them a little bit of fennel tea. No one's exactly sure what causes colic, but like I said, I assume it's discomfort in the digestive system, a gas bubble. Your baby's small intestines are small and they're new, and so there's a lot of muscular tension on the walls, and when there's gas, that kind of forces the intestine open, and that's painful. So signs that a baby has colic are arches in their back while crying, or if they're clenching their fist while crying, or otherwise seem to be in pain. Green poop. Occasionally green stools are normal in newborns. It basically means that they had extremely fast bowel transit time. And so if that's consistent, it could mean there's an imbalance somewhere. And it also causes an imbalance. If they're always getting green poop, then they're losing lots of bile and iron. If your baby's getting green poop, it could mean they're sensitive to something in the breast milk. It could also be a sign of a virus. Teething can also cause green stools. Why? Because the increase in the baby's saliva while teething causes them to be swallowing a lot of saliva, and that irritates and upsets their stomach. If your baby's eating solid foods, then green poop can also just be a sign that you ate lots of green food, like spinach. All right, congestion. Kapha is easily aggravated in children because it's kapha time of life. If they're having breast milk or formula, then they're having sweet, rich, mucus-producing food. If they're eating what kids normally like to eat, then it could be a kapha aggravating diet. Also, children are still developing their gut flora, so digestion may be weak. If your children have congestion, then you can suck it out with a nose Frida that's pictured on the bottom here, or with a bulb syringe pictured on top. This is an essential tool for every parent to clear your children's airways, because babies hate when they can't breathe through their nose. If your baby's having problems with congestion, and then the mother should eat more bitter foods if they're breastfeeding, or a more kapha pacifying diet in general. If the mom's not breastfeeding, then you're going to do that then the child's diet will be less kapha aggravating and have more bitter foods. Also more pungent and mucus destroying foods like aromatics. Aromatic herbs like cardamom can be really beneficial to destroy mucus for a child. Generally avoid dairy if your child has thick mucus congestion. But treat the mom or the baby with kapha pacifying herbs like ginger, turmeric, and honey. Ear infections. Kids get ear infections because their eustachian tube is more horizontal and doesn't drain as easily. And there's more about that in our lectures in our YouTube channel on ear, nose, and throat. Lots of kids have a vitamin D deficiency because people aren't getting outside enough anymore. And you need to be outside in the sun to produce vitamin D. Breast milk generally is low in vitamin D also. So unfortunately, you're not supposed to put your kids in direct sunlight until around 6 months old. So this baby has a lot of their body covered in clothing, but that's still good enough to help them produce some vitamin D. Delicate skin, though, is just no match for the power of the sun. Moms can add more vitamin D-rich foods in their diet or in the baby's diet to transmit to the baby if they're breastfeeding. And mom can also supplement as directed by a doctor. Here's another controversial issue. It's around sleeping and sudden infant death syndrome. Research these days shows to put your baby on their back for sleeping to reduce the risk of SIDS. But this recommendation is the exact opposite of what it was a few decades ago. So a few decades ago, it was you should sleep your baby on their stomach. And then it became sleep your baby on the side. And now it's put the baby on the back. And all of this, it just goes to show that the research, even if it is conclusive, the percentage difference is very low. So putting the baby on the back, yes, in some studies it's been shown to reduce SIDS, but the percentage difference is very, very minor. And really remember that you're only looking at one symptom here. So yes, the incidence of SIDS may go up slightly if the baby's on the stomach, but what about all the other factors and all the other issues? I find with all of my kids, they sleep much better on their stomach, and good sleeping is also healthy for your baby. So I'm not going to say what to do for you in your situation, in your life. What I will say is that the risk of SIDS definitely goes up for parents who abuse alcohol and drugs and who are smokers. And also, if your child's being exposed to secondhand smoke, it increases. Also, it increases if you're co-sleeping with a smoker, as well as if you're smoking during pregnancy. So there's lots of different risk factors there. It's a little bit complex. And I would just say that do the research, check it out, and decide what is right for you in this area. Around co-sleeping, it's generally recommended that the baby sleep in the parent's bedroom for the first year, but not in the same bed for minimizing SIDS. Keep the crib free of toy and other clutter, no bumpers, etc. So basically, the recommendations around this are to avoid anything that could suffocate the child. So if the child's sleeping in the bed and the parent has had a few glasses of wine, it might not wake up if the child is struggling to breathe. Maybe the parent will roll on the child, and that will create a carbon dioxide chamber where the child can't get oxygen, and that could cause sudden infant death syndrome. Also, if the baby gets caught between the crack in the bed and the wall, etc. I don't want to get too much into this because really I want to encourage you to just research it yourself, but don't get yourself too paranoid either about it. Just try to keep some level of reasonableness there and recognize that there's more to the baby's health than just prevention of SIDS. Lead poisoning is another issue. You can stop and read and check out this slide a little more. But basically, when babies start to crawl, they can expose themselves to dust on the floor and start eating paint chips around the windowsills, etc. So have your home tested for lead paint. Pinworms, another big issue with kids. They get the pinworms because they pick up the eggs when they're crawling around. And when one child has eggs, they tend to spread them all over the house. So if you go to your friend's house and their friend has pinworms and they don't even know it, there's just eggs all over the place. And then they pick up the eggs while crawling and get infected. So how do you prevent pinworm infections? By not spreading them. Wash, if you know your child has an infection, or if you see your child itching their butt, because that's what children with pinworms do. The worms make them make their butt very itchy, and then the kids itch their butt in the middle of the night, even while sleeping, and they're not even aware that they're doing it. So then they have the eggs under their fingernails, and then the eggs get all over the house. So if your kid is itching their butt, suspect pinworms and start washing their hands when they first wake up in the morning. If you see a pinworm on their poop, it'll generally be alive and crawling about, so you'll know that they have a parasite and a worm. Just give them some over-the-counter dewormer. That's the best thing to do. in my opinion, very few side effects to that. Yes, you can try to do it with herbs, but the deworming agents generally have very few side effects. So they'll be effective. Then wash and vacuum all the linens and floors, the couches, etc., just to get all those eggs, out of your home environment. You can, while giving them the over-the-counter medications for pinworms, also give them antimicrobials in their food, pumpkin seed, and anthelmintics in their food, actually. Pumpkin seed, papaya seed, even coconut oil, garlic, cloves, etc. Avoid heavy sweet foods when you're treating worms. Just because those heavy sweet foods can strengthen the worm. Some anthelmintic herbs include vidunga, wormwood, ajwain, and bringarage.